Earl Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m., here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. on BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And a very good evening to you. This is Your Health Matters, and it does. It really matters. And this is Dr. Gerald Thompson, your host. And as you know, it's interactive. You could call in. I know a lot of people usually listen, sit back and listen what the topic is, and they digest it. But we want to hear you. We want to hear you. Number 457-9997. Same WhatsApp number, 457-9997 on WhatsApp. Send us a text. Send us, just give us a call, But if you're listening, we love that too. And a lot of people meet me and say, I listen to you every Wednesday and so, but I suppose people just want to digest it and take it in. Over the last few weeks, Kamal, I've been talking about genetic things, and I've been emphasizing men and women, right? The sex chromosome, X and Y, and this, that, and so, right? I've been doing that. If you've been listening to me, well, tell me, do you know that there are some stark differences in how common health conditions, such as a heart disease, affect men versus women? Common diseases may affect women and men in different ways. This evening, I really want to talk about women's heart attacks, a women's silent heart attack. But I want to start off by exploring the differences between men and women. You know what I mean? That's important. So gender differences in common health condition. Let's start off as we'll talk about. We'll come back to heart disease, but we start with it. Men and women can be affected by the same health condition, but in different ways. And symptoms may be similar, but how these conditions manifest themselves in the body of a female and the body of a male and the type of treatment needed can vary because of gender, because of man versus woman. And both sexes are prone to specific diseases. But for some conditions, such as like heart disease, which affect more men at an earlier age than women, and health experts are a little unclear why. But let's dive into heart disease. Heart disease affects men at an earlier age than women. We'll get back to that. Now, heart disease is the leading cause of death in both men and women around the globe. You know that? Heart disease kills most women than other diseases in women. And heart disease kills more men than other diseases in men. Heart disease is bad. It's a terrible thing to have. Don't have it. Throw it away. Get rid of it. But men are at a higher risk at an earlier age. On average, women develop heart disease about a decade, 10 years later, due to the protective effect of the female hormones in their body called estrogen. But when a woman goes through menopause, after menopause, and the estrogen level drops, the ovaries are no longer producing estrogen, the risk of heart disease can go up in women. And heart attack symptoms in women may include the usual thing, shortness of breath, nausea, neck pain, but it could also experience some strange symptoms. And we're going to get into that sort of thing, such as fatigue, rather than the classic chest pain where your chest is tight, and pain is hurting you, the man clutching their chest. That's the classical type of heart attack. Women have it differently, you know? So the traditional risk factor of heart disease, such as the family history and you know, all those other things, it's the same for men and women. You know, there's a family history in your family, and your woman, you could get the heart disease too. If there's a family history of heart disease and you're a man, you could get that family history and prone to heart attack too. You know, but ironically, however, women have a higher mortality, a higher death rate from heart disease than men. Men get it earlier. Women get it after menopause, but when women get it, they have a higher mortality, usually because the heart condition, the heart attack, is underdiagnosed and undertreated. It's not taken seriously. We say the woman is emotional. Woman is just, but you know, in her 50s, she's 60, developing heart disease and so forth. Doesn't know it. We say it's anxiety and all those sort of things. Could be anxiety as well, but it's usually undertreated, and women have to watch out. Women are also more likely than men to develop blockage of the small, tiny blood vessels in their body and in the heart. Do you know that there are big blood vessels that carry blood to your heart called the coronary arteries? Well, when it gets smaller and tiny as they stretch out, women tend to have blockages of the small ones downstream rather than the big size coronary arteries. It's not good. It's not good. So, and postmenopausal women in particular are subject to sudden changes, unusual changes in the shape of their heart. We've discovered that there is a heart condition, right, in which the muscle takes a different shape. I wonder if I should say the word, yeah? Takotsubo cardiomyopathy. Takotsubo cardiomyopathy. Yeah, of course, developed by the Japanese, discovered and so forth. And this is strange. They say it is caused mainly by emotional stress. So the heart muscle and Takotsubo cardiomyopathy caused by stress, chronic stress in an older woman, worried for whatever reason. Many reasons could cause that. And it can cause this serious condition in women. We've been picking this up. Anyway, what next? Hypertension. Hypertension is also known as high blood pressure and affects about 85 million people around the globe. This number is growing, and hypertension is more common in women than men. I want to go on. Breast cancer. Of course, I'm balancing it. Most women are well aware of their risk of breast cancer. About 1 in 8 women in the United States, about 1 in 8 women in St. Vincent, 12% will develop invasive breast cancer that spreads. Do you know that? As a woman, if you're in a group, and a group of 8 of you, 1 of you may well statistically develop breast cancer. It's not nice. And that's over the course of the lifetime. Now, but men get breast cancer too. And typically, they do far worse, much worse with the breast cancer. Men with breast cancer don't do well. They die very quickly. I shouldn't say that, but it's because it's not taken seriously. A woman, as soon as she picks up a lump and so forth, the average woman will go and deal with it and so. Stroke. While many of the risk factors for stroke are the same for both men and women, including there being a family history of stroke. If there's a family history of stroke, then you may be at an increased risk of a stroke too. High blood pressure and high cholesterol are big causes of stroke. And some risk factors, though, are unique to women. These include taking a birth control pill. Do you know that, I think last week, we were talking about blood clots, Birth control pills are notorious for causing blood clots. But obviously, a man wouldn't be on a birth control pill, but women on birth control pills, they have a higher risk of blood clots. And that blood clot could be near the brain and cause a stroke, right? Being pregnant can increase the risk for stroke. Some women go through something called eclampsia. It's a difficult pregnancy where the blood pressure just goes up. Or if you have hormone replacement or having frequent migraine headaches or you know, these are the number of these things. But these reasons may substantiate that about 55,000 that there are far more, I would say, strokes in women than men. Far more strokes in women. It may be related, as I said, to the migraines and being on birth control pills and so forth. But we are still looking at other explanation. But another possibility is that women live longer than men, you know? So that if man dies from something else and woman continues to live, a wife continues to live, a stroke may be one of those things that will finally catch up with her, you know? Diabetes. Now, this disease, which affects a lot of people, I tell you something, Vincentians, diabetes is hitting the Caribbean people hard and tends to be more severe in women than men. Oh boy, I've been talking a lot about women diseases. Diabetes, which impacts how the body processes sugar, can increase the risk of complications, like the same thing we talk about, heart disease, kidney disease, vision problems, among other problems. Now, researchers speculate that the good cholesterol, which is normally higher in women than in men, may be behind this problem, right? And once again, more women have severe diabetes than men. Now, it's felt that women normally have a higher good cholesterol, but when the good cholesterol level is low in a woman, so women, that's one thing. When you go to the doctor and you get blood tests, make sure you get a HDL, a good cholesterol level. If it is low, it is one of the risk factors for heart disease. Don't let it be less than 40. 40 is that limit. Not trying, but I hope it's up somewhere about 100 or so. And there are lots of things they say these days, exercise, grapes, and other things like that can raise your good cholesterol level or help you raise your good cholesterol. Now let's get to something else, hair loss. Now both genders experience hair loss. However, men do have a higher prevalence of hair loss. Now, did I need to say that? A lot of people shave their hair, but really, they were really going bald in the first place. They were really going bald in the first place, you know? And I may have to start doing that myself. But as a style, I have to start shaving my hair. My hair doesn't look so, my hair looks like a little mop, right? But the thing is that male pattern hair loss usually begins earlier in life, and men lose from the front, right? And the top of the skull backwards. Men lose from the front of their skull, of their head, the skull, and to the top of their skull going backwards. You know? Now, this leads to a receding hairline and a bald patch on the top. Now, female pattern hair loss usually begins after the age of 30 and is much more subtle, much more slower. It's diffuse. They lose hair all around. The hair starts to thin out, right? And they tend to have preservation of the hair in the front of their scalp. Come out, you hear that? The hair in the front of their scalp is preserved. They tend to lose the hair a little bit more in the back, and it thins out. Men starts in the front, go backward. Now, acne, while we tend to assume both gender experience this same type of thing, the skin condition called acne, especially during puberty. I mean, oh gosh, both males and females start getting acne during puberty. It can ruin your life sometimes for a young adult, you know. Now, this is likely due to a lot of testosterone. That's the male hormone being in the body, and an increase in some special glands in the skin that produce oil, and some of these glands could get blocked. However, women tend to seek out physicians and treatment dermatologists for acne more than men. And the type of acne that tends to remain into one adult's years tends to affect women, unfortunately, more than men. And this is the reason why women tend to visit dermatology more. So the point about it I'm making is that acne is common in both sexes. Women tend to seek treatment because they feel it impacts a lot more on their look, and they seek treatment. They're usually successful in dealing with it. But there's a type of acne that persists into adulthood, doesn't go away after teenage years, and that is often in women. Autoimmune disease, I'm talking about lupus and all these other things. Again, boy, these are more common in women by an astounding 75%. Autoimmune disease, where the body starts to attack itself, lupus and other arthritis, and so far more common in women. 75% of these autoimmune diseases occur in women. I've been hitting women a lot tonight, Skin cancer, though. Approximately 1 in every 5 persons in the north of this globe, so in Canada and Scandinavia and so, can get some form of skin cancer in their lifetime. Not all skin cancers are very dangerous. The big one being a melanoma. Oh boy, that could spread. But the skin cancers would typically occur in light-skinned people, though, and exposure to sunlight is the big thing. But men are less likely to be vigilant. If men see a mole, they ain't studying that. You know, Kamal, I see a couple of moles and so forth. Your face. You ain't studying that. Women would look at that. And so if they see any changes in the shape of the mole, they may go to the doctor, right? And they want to get it out early. They want to cut it out. Men might leave it. And if it was a cancerous type mole, it might have spread. Bone thinning, something called osteoporosis, bone weakening disease. Again, this is something that women in particular are at a greater risk than men. 1 in 2 women are affected compared to about 1 in 4 men. You know, about 50% of men, about a lot more women are affected by this, by thinning of the bone. Depression, mental health conditions can also differ between the sexes. Sad to say, depression and anxiety are twice as common in women. I've been hitting women hard. You know what I come out? I've been saying everything. Multiple sclerosis. Have you heard of that disease before? Multiple sclerosis. It is it's a kind of disease that affects the nerves, affects the nervous system. Although women are 2 to 3 times more likely to develop multiple sclerosis than men, guess what? Men are more likely to have the more severe type of multiple sclerosis and not do well with it. You know, multiple sclerosis, psoriasis. Well, this is one that's definitely more common in men, you know, and we essentially are seeing these set of diseases, with 12, 13 of them, we're saying predominantly more common in women. Now, we can have the break, we're going to come back, and we're going to talk about specifically women and heart attacks. Women and heart attacks.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. So we're still looking at the difference between men and women, and I'm now focusing on one particular disease, what we call heart disease, cardiovascular disease, heart attacks, all these things, same name. Now, globally, about 1 in 3 women will die from cardiovascular disease. You know, there's more than 1 in 3 men that will die. But this is alarming in terms of women dying of heart attack, because it never used to be like that, you know? And while symptoms can be different in women than they are in men, it doesn't necessarily mean that the women have atypical symptoms or that the symptoms are not real, as this is an erroneous. It has long been said that women have a strange type of feeling about heart disease. The symptoms are strange, but really what's been happening is because long ago women were not the ones having heart attack, it was predominantly men. that the area of women and heart attacks have not been so well studied as the study of heart attacks in men. Right? Now, there's, a feeling that women think a heart attack would feel like the same as a man. Let me just say, when a man is having heart attacks, typically, we all know the heart is right here. The heart is right here, behind your breastbone, behind this bone here, this plate of a bone called the sternum. Heart is right there. Truthfully, the heart is kind of twisted a little bit like this, a little at an angle. And some big blood vessels come off of the heart and pump blood through your neck up into your brain. And the heart is like a muscle. See, the muscle in your arm? Well, I want you to consider your heart to be a real specialized muscle. And due to certain electrical things, the way the Lord made us, the heart is beating and beats at a nice rate. You don't want the heart to beat too slow. You don't want the heart to start beating fast. You don't want it doing that. And you don't want it breaking too slow. You don't want it. You want a nice beat, 60, 70 beats a minute. But because the heart is muscle, that muscle needs its own blood supply. And there's a system in terms of how blood gets into what's called the coronary arteries and supplies the heart so that it could continue pumping. Because the heart is the most active organ in your body. If you're sleeping, you're using the muscles in your arm, you're using the muscles in your leg. If you're a bike rider, you're not using the muscles and so behind your thigh or anything like that, if you're resting, but you use them when you're doing bike riding. But everybody who's alive, their heart is beating. And their heart is beating and contracting, and the muscle of the heart needs a blood supply. And the blood supply is bringing oxygen, it's bringing nutrients, it's bringing sugar, it's bringing minerals, it's bringing a whole set of nice things so the muscle could continue pumping. Well, sometimes those blood vessels inside the heart, those coronary blood vessels, can get blocked. And when they get blocked, it's a heart attack. And so men, because the bigger blood vessels bringing oxygen, blood, and nutrients to the heart can get blocked, a man, when that heart blood vessel gets blocked and no oxygen and no sugar, no nutrients should get to the heart muscle, the heart muscle starts to cry out with some pain. Let me tell you that. Come on. And you start experiencing a crushing pain, a squeezing pressure. It's as if somebody is sitting on your chest. It's as if somebody's standing on your chest. That's how it's described in men. But guess what? In women do not typically have those same symptoms, So it is to be expected that the female heart attack symptoms, while sometimes it is similar to the man, in the general sense, they can experience a different type of heart attack, a different type of pain. And it's usually because It's maybe the smaller blood vessels of the heart that are getting blocked and affected, right? And this is what's not causing this crushing pain. Instead, you're having something else, different symptoms. I'm going to describe them to you. Now, what is happening when a woman's main arteries are blocked? She often experiences some different symptoms. She will still have chest pain and a pressure and a tightness, but she can have some other symptoms, what we call non-chest symptoms. And we're going to go through that. What's more, not every woman experiences the same symptom, right? And the symptoms may, you could say they don't necessarily happen all at once. Sometimes in men, all these symptoms are happening at once. A man, pain. At the same time, he's having pain going down his arm. He starts getting sweaty. He starts getting short of breath. He starts feeling nauseous. Women, some of those symptoms can occur at different times, not all at once. You know, women's symptoms can be less dramatic than this crushing pain, somebody sitting on your chest. It isn't like that, right? Instead, they may have a feeling such as fatigue. That's strange, just fatigue. Or they may have jaw pain. So the chest pain, they may have pain in their jaw. Or they may have back pain. Or just like the fatigue, they may have a common feeling they feel run down. They feel run down. All of a sudden, they feel run down. And these are some of the feelings. Now, let's go through them. They could have a funky feeling in their arm. What is that? A funky feeling in their arm. You know, they feel as if their arm is like gone to sleep. Anybody ever ever had that? Nah, well, in women, they would be concerned, I'm talking about an old woman, that they're having a heart attack if they start having that. You understand? They should be, right? And this is something that is serious. This funny feeling of your arm going to sleep. Now, your jaw may be sore, a really sore jaw. So along with the arm going to sleep, fatigue, and shortness of breath, there can be a soreness in the jaw, not in the chest, in the jaw. That's strange, isn't it? Eh? And it's like the way your mouth feels after you've come home from the dentist and they've put some numbing thing, some Novocaine, and it hasn't worn off. That's sometimes what a female may feel, if I could describe it that way. And besides the arm and the jaw, the pain, you know, it's not this crushing pain, right? Now, she could also have nausea and vomiting. Nausea and vomiting. And it's said that during a heart attack in a woman, about 2/3 of them, about 60-something% of them experience nausea, indigestion, stomach ache, feeling like they want to vomit, or they vomit. Now, men, much less men experience that. You know, much less. Women can have shortness of breath. And early symptoms of a heart condition can be the need to prop yourself up in bed. I'm talking about, you can't lie down flat because you feel short of breath. No, come on, I'm not talking about you, right? I'm not talking about the young female who's 19, 20, 25, 30. I'm talking about you, the female who's 55, 65, 75. You can't lie down flat anymore. You have to prop yourself up, right? And you now have to sleep sitting up. Of course, if you're in bed with somebody else, your husband or what, he ain't gonna like that, you know what I mean? Right? Because you're disturbing him and so forth. Right? But it's an important sign. I want to get back to extreme fatigue. Women tend to dismiss heart attack symptoms because they're used to feeling uncomfortable every month during their monthlies, So they say they're used to that. But the key thing is when they get checked and assessed and they're having this extreme fatigue that's going on. It isn't the 3-day, 4-day episode of monthlies. It's not happening during that particular time, and it has to be taken seriously, and it really has to be taken. Now, it's easy to write off fatigue as a side effect of life, aging, working hard, children, grandchildren, and all these kind of things, worries, But for women, the hormonal changes that occur with menopause, right, certainly can be exhausting. But in many discussions with healthy adults and aged people, this fatigue, extreme fatigue is often missed. Now, how about upper back pain? Back pain. I talk about jaw ache, pain in the shoulder, in the arm, but pain in the back, but not in the lower back, not in the middle back, but back here in the upper back. This odd feeling also in the chest. So all these symptoms are not the classical harsh pain. It is more one of fatigue. I decided I was going to describe those symptoms, like a jaw pain, a pain in the upper back, not the upper chest, the upper back, nausea, vomiting, shortness of breath, fatigue, extreme fatigue. I decided to describe them because I wanted you or your significant other that if you're having any of those things, and you are of a middle age or you are older than 50, this may be a heart attack. And certainly if you have the risk factors for it, such as you've had a heart attack before, you have high blood pressure, you have diabetes, and you're under a whole ton of stress, then this is something that you should be. Now, a woman undergoing a heart attack could also have what's called some flu-like symptoms. They could say, I'm so tired. I must have a virus. I must have a virus. They might convince themselves that all they have is flu-like symptoms, many which resemble the same kind of condition of fatigue, right? Including body aches and fatigue and nausea, which can also be signs of menopause. So is it menopause or is it a heart attack? Trust, you got to know your body. and you got to know what kind of pain and so forth you experience. But these are things that now I want to say during these are some of the symptoms that women will experience in the body. Now, so earlier in this program, I went through outlining a number of conditions that occur both in men and women, but if you were checking the list, a lot of them tended to occur mainly in women, especially autoimmune disease, that's lupus and all these kind of things and so on. But one of the diseases I mentioned was heart disease. And I said that women, like men, heart disease, I've got to use this word, is the biggest killer. Heart disease is the biggest killer. The average individual, we, you, I, we're going to die of a heart attack. I'm sorry to be that morbid. I'm sorry to say it like that. We're going to die of a heart attack. And with men, the heart attack comes on. Chest pain, God, pain, crushing pain, something in your chest. Women, it's all these little things, jaw pain, upper back pain, pain in your arm, little nausea, fatigue, extreme fatigue, shortness of breath, with both men and women, get into an emergency room early. I'm talking about within 10, 15 minutes can save your life. If you get into the casualty department, emergency room, they'll quickly assess you, find out if what you're going through is really a heart attack, and if the heart attack is being caused by a high blood pressure, by high blood sugar, by some other condition that's affecting you. And they, no doubt, will put up a drip, put up some life water, as we call it. You understand? Where they could give medications to put them in your veins. And some of these medications could help bring down the blood pressure. You have a caller? Hello, good evening. How are you?
Good evening, Mr. Thompson.
Yes, how are you?
Mr. Thompson.
I could talk up a little louder?
Hello?
You could talk up a little louder for me?
If I could talk a little louder?
Yes. Are you hearing, Kamal? You hearing? I'm hearing you. Go right ahead anyway. You just sounded a little soft.
Okay, well, we'll talk a little louder.
Yeah.
Warning about diabetes.
Yeah.
I never had suffered diabetes, blood pressure.
Yeah.
But how I get to come by diabetes, that I was real good. But I have a truck and I used to drive that all the morning, get up all the in the morning and go fishing in the river.
Yeah.
And that bring enough ignorant, no? Ignorant is called that. But that bring a fever up on top of me.
But by going fishing in the morning, or on one occasion when you went fishing, you caught a fever, right?
Yeah.
Okay, go ahead.
Then I caught a fever. It looked like my body temperature dropped down kind of low.
Oh.
And that's how I come to get diabetes.
Okay.
What is the advice on that? If any advice upon top this thing?
Mm-hmm.
Because I never had suffered diabetes, but from the time I catch a fever, then the diabetes come for me that I never had. Is it possible that is it fever that I lose my body temperature, but that
Yes.
diabetes from me?
Can I tell you something? I want to answer you with the answer of no. And let me explain to you why. The chances are you were developing, huh? Well, you listen to it. Okay then. For that caller, the chances are he was developing diabetes for several years before this episode occurred. Diabetes is notorious for affecting your immune system, lowering your immune defenses, such that a flu, a virus, could be easily picked up. In your blood, there are these white blood cells that fight off infections, protect you, bodyguards. They're the army inside your blood. And anything trying to invade, any virus, and so these white blood cells, especially if they've seen them before, will try to attack them and get rid of them early. You know, stitching time save 9. You know, they nip it in the bud. They don't allow the virus to go anywhere. However, when you start developing diabetes and your sugar has been running high, you know how do we make rum? How do we make strong rum? We use what? We use molasses. We use sugar, molasses. But could you imagine sugar in your blood? Guess what? These white blood cells, there's a way they kind of, all your cells start converting the sugar into alcohol. You start brewing alcohol, ethyl, in your body. I'm saying it figuratively. And the white blood cells get drunk and lazy. So if a virus starts to come in, the white blood cells are laughing and partying. They're drunk somewhere, and the virus could get in and affect you. So for that caller, when you started having the fever, let's say that fever was being caused by an infection, a virus or something so, it's probably because the diabetes had been there for a couple of years, lowering your guard, lowering your immune system, such that the virus could get in. And that, lucky for you, you caught that virus, and then you went to the doctor and they pick up that you have diabetes. It would not necessarily be, it's because the virus then caused the diabetes. And so you probably had it going on before. Now, I like the fact that you used to fish and so forth because you were doing the right thing, eating the right thing. But I don't know what else you were eating. I don't know how much stress you were under, how much other things you were putting on your plate, whether you were consuming some bad things that were inducing diabetes. I don't know if diabetes runs in your family. If your father had diabetes, or your grandfather, or your mother, or your grandmother, and then if both of them had it and gave you the genes for diabetes I was talking about the other week, you got genes from your father, genes from your mother. What happens is that there's some people who will develop diabetes early, and then there's some people who we call late developers. Let's take this next call. Hello, good evening.
No, it's just me again.
Yeah.
I say fish, eating fish was good and everything.
Yes.
But you know what happened? What really just exactly thing that happened to me, because what happened? My mother had diabetes, right?
Yeah.
And my mother, she never treated I have diabetes in family.
Yeah.
What happened? Why did I get what blood sugar thing that I get that low on? If this thing was working on me for a long time.
Yeah.
I used to work in the grenadines, right?
Yes.
And I used to work real hard, but what happened?
You have to eat properly.
I may not to get water all the time.
Yeah.
So if when I get something in the grenadines, we do buy juicy. Hello?
Yes. Soft drink, soda.
Yeah. And I believe that is where it was working on me all the time, because
yeah.
And in exposed to too much water, sandpipe and all that thing.
Matter of fact, you have to buy water a lot of the times, right?
Yeah.
Yeah.
No, you should buy juice.
No, the point I'm making, you don't have a lot of water in the pipes and so forth, especially the dry season. There's not a lot of water and so forth for a lot of things, right? So you were drinking sodas instead, Juicy and Buster and all that kind of thing.
Yeah. And one duty was to satisfy me at somebody 2 and 3.
Huh?
Somebody 2 and 3.
Am I hear you used to drink 2 and 3, you said? Or what? Is that what you said?
Yeah, 2 and 3 duty. Well, maybe in every hour.
Wait. You know something? You remind me of me. When I came back from England at the age of 14, I fell in love with Red Juicy. And I used to go down to Paul's Avenue. We lived at Mackey's Hill. And I used to throw down a Juicy. And when I'm leaving the shop, I felt like another one. And I threw down another one. And I used to drink 3 Juicies too. Yes, sir? But do you know the amount of sugar you were taking at that time?
Because that's why I was ignorant by fact, because people used to talk about diabetes, but I never really said about it. I did what I don't know that can happen to me. And in Trinidad, you have a big one they call a liter.
Yeah.
A big one I would put a pan, a cheese pan.
Yes.
And we used to feed on that, just making juice and anything like that.
Oh my God. So
I want to want children and them. People look plenty juicy. To tell them there's a part this way in getting diabetes, and if we sweet is come on you. If we want sweet is.
Well,
the thing I want is sweet, but never want make it worse.
Well, you know something? Go ahead.
I just want to say sweet enough and still put sugar. And the children are falling up with sugar and sweet things.
Yeah.
I warning them.
Yes.
They will suffer any later, because
Okay.
if you tell your parents they are diabetes, you could bring it down on yourself.
Well, can I tell you something? The way in which, no doubt, you have to reduce the intake and the consumption of these high sugar products. But I will tell you something else. There is some other type of sugars. And I was very concerned after Soufriere eruption when I picked up a box that had come in from overseas, and the amount of products that have in a special type of synthetic sugar called high fructose corn syrup. And almost every item in that box to be distributed to the shelters had in this high fructose corn syrup, worse than the Juicy. Plus, I want to tell you that to counteract this, it is the amount of fiber that you should be eating, and that there are certain foods that have in some good amount of what we call soluble fiber that helps to protect your gut, your intestine, and reduces the absorption of the sugar. I'm glad you called today. That's a good warning you've made there. I have to dig into it a little later too. Okay?
Yes, and one more thing before I go.
Yeah.
You know that sometimes I just, when I say high sugar thing, I don't really use too much of sugar thing, but I use a little bit. And it feels like it's a whole ton of that I tell you. But sometimes I try to avoid, even when I'm drinking milk, I don't put sugar at all.
Okay.
Sugar, but
Man, okay. Okay. Yes. Well, next week. Sure. Okay. Thank you. But we're at the end of the program now, so I'm going to stop you. Thank you very much for calling, But ladies and gentlemen, next week I'm going to talk a little bit more about diabetes. You bet. But today I was talking about the difference in how some diseases affect men and where they affect women. Same disease. But I wanted to talk more specifically about heart attacks in females and how the symptoms that they have is different. Pain up in the jaw, pain up in the upper back, pain coming down the arm, a funny feeling, the feeling of the arm going to sleep, feeling fatigue, extreme fatigue, nausea, shortness of breath, all these sort of things. You know, women, sadly, you know, you have to watch out too. You know, heart disease is a big killer, both men and women. And next week, we're going to talk a little bit more about diabetes. Ladies and gentlemen, I want to bid you a very pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m., Monday to Saturday. Call them today,